Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any adult growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. So just bear with us in our program and we'll try to be a very, let's say, light guest in you every week. Hi there. In many occasions we've seen films that talk about schizophrenia. Some of those films are really very famous. For example, the film Beautiful Mind and other, let's say, Hollywood actors that perform the character of the schizophrenic patients. So in a simple, let's say, words, schizophrenia, it's a mental disorder that usually involve hallucination, delusion, disturbed thinking, and even disturbed speech in a way that will affect the behavior of the patient, and it will also affect his thinking and the performing of even the simple daily activity towards himself and towards the community around him. Actually, those symptoms usually will differ in either severity or even the occurrence. Sometimes it will be only, let's say, like visual hallucination to the patients, or it's only a very mild delusion, along with, let's say, unpredicted or let's say, thinking of the speech that the patient usually will use. So all of these symptoms are characteristic of the schizophrenia for the patients. Either most of them will be there, or only some of those, let's say, symptoms will present to the schizophrenic patient. So would these symptoms will be disabling for the patients with the schizophrenia? Yes. Most of the time, by the deterioration or the developing of severe symptom, they will produce what we call it as a physician as a disabling behavior, because what will happen that the patient will think about something which is unreal or not real at all, or thinking of a character that usually, let's say, ask the patient to do things which is totally unreal, and then it will end up by a very abnormal behavior and a very disturbed behavior for the patient and even for the family around him or his friends. So all of these will make the patient in one point of his life as a disabling, let's say, person in the community. So would these symptoms differ from age to age? Yes. Usually the symptom that I've already mentioned, or what we call the negative symptom, usually will happen in the adult. But what about teenagers? Teenagers usually they will have something what we call the withdrawal from the community, like the school or the friends, and then abnormal behavior, lack of interest. Sometimes they will have loss of weight or even lack of healthy diet during their life. So these symptoms usually are specific for the teenagers rather than the adult patients. Another symptom of the teenagers is the dropping from the school or dropping of the school performance. Usually he will be like an A student, and then all of a sudden you will just notice that he starts to skip school and he'll start to have a very depressed mood of thinking and behavior towards the teacher or even towards his colleague in the same class. So these symptoms should be like a red light for you, the mother or the parents, let's say, of that patient, teenagers, is to alert you to take action towards these abnormal behavior. So what is the causes of schizophrenia? Actually, it's a mix between genetic and environmental causes. Most of the time, we have a positive family history of schizophrenia in the family, along with the environmental effect of the, let's say, the community or the family, or most of the time it's the mother who's affecting those patients in the environmental point of view. So it's a genetic and environmental, let's say, causes or contribution that usually will cause schizophrenia. So what are the complications of schizophrenia, or why schizophrenia is very important to be recognized in the early stage? Because one of the complications of schizophrenia, unfortunately, is the depression that usually affects the patient. Suicidal thinking or suicidal thought. OCD, what we call it, obsessive compulsive disorder. Sometimes the effect of the patient that will make him get abused to any kind of substance, for example, alcohol or narcotics, drugs. These are the usual complication of schizophrenia that we need to take, let's say, care of and to be aware of, starting from the suicidal thinking up to the abuse of any symptom. Sometimes the patient will be affected by withdrawal from the community, neglecting of himself, and then it will just affect his, let's say, physical health. For example, they start to develop obesity, they'll start to develop chronic diseases, and most of the time the neglect for the patient himself or for his health usually will make him more prone to chronic diseases or even acute, like for example chest infection or any infection in his body due to the lack of interest and the lack of cleaning. So what is the important thing to do with those schizophrenic patients? The most important thing is not to neglect those symptoms. Taking him to a specialized psychiatry doctor that can deal with this, let's say, symptom. Diagnosis of schizophrenia is, I will not say it's easy, but with an expert hand, it will be easy and it will be managed easily, hopefully.